Good afternoon once again, and welcome our viewers. Today, we are here to talk about hypertension in pregnancy. We know that hypertension in pregnancy or gestational hypertension is the most common medical condition, which is also leading to most of our mothers dying or our babies dying. So, we at Casson's Baby Ghana are bringing this program to all pregnant women, mothers to be, to all partners, then also to every family member so that we'll pick a clue, learn something, so that we can share with our fellow women, so that the myth around town, we will clear the myth. Now, somebody will say hypertension in pregnancy. Now, hypertension in pregnancy is when you have a recurrent of BP, which is more than 160 over 110. So, under three successions, not only one, with the first diagnosis, we can't say you have hypertension in pregnancy. But with the second and the third and the fourth, we can definitely diagnose you that you have hypertension in pregnancy. And there are classifications of hypertension in pregnancy. So let's look at our classifications of hypertension in pregnancy. So, our first one is hypertension present in the first 20 weeks? So, with the first 20 weeks, we can say that when you look at the chart on the screen, either pretending pertaining the pregnancy or recognized prior to 20 weeks of gestation. So that one, either it starts immediately you get pregnant, or you're already having the hypertension already, and when you got pregnant, the BP started going up, or by 24 hours, like when you're in the house within 24 hours and you are below 20 weeks or exactly 20 weeks, and the blood pressure you are monitoring keeps on going up, keeps on going up. And that at the top of it, we know chronic hypertension. Then the major due essential hypertension. Then why caught hypertension when it elevates from 140 over 90? So you realize that whilst your first BP was checked at home, you realize that it was maybe 140 over 90. The next 4 hours, we recheck from 140 over 90, we get to 160 over 110. It keeps on going up. It keeps on going up. It doesn't come down. That one is not good for us. Then also we have hypertension, which arises after 20 weeks, sorry. So for the 20 weeks, when you have it and they realize that the mother's life is at stake, possibility that education can be given, and then the baby will be terminated to save the mother. So immediately it crosses 24 weeks and the BP starts going up. Then when we monitor, like I said, if it goes up above 160, 110, monitoring is being done. So then we realize that one is because of the baby. That is why the BP keeps on going up, going up. And when it goes up, at the end of the day, you can have preeclampsia. At the same time, you can also have eclampsia. Then, when you're a chronic hypertensive patient already, like you're a known hypertensive patient before um, getting pregnant, they've given you all your medications, they even increase the dosage, and you realize the BP is not coming down. It keeps on going up. All the cardinal signs are there. When education would definitely be done, you'll be cancelled, you and your partner, you'll be cancelled. Then, based on that, if pregnancy still needs to be terminated, because at 24 weeks, pregnancy can be terminated. And but if it's around 28 weeks, 30, 34, and you cross that stage, we are expecting that medications can be given so that it will develop baby's lungs, and baby will be delivered so that baby can be sent to the ICU, and baby will be monitored till baby's parameters are all okay. Then we can say you are fit to go home. Let me take it again. Now, with the classifications, we have the chronic hypertension, which if you're a known hypertensive patient, if care is not taken, you can develop preeclampsia. Then from preeclampsia, you can get to eclampsia. And when it gets to eclampsia, it can cause the death of the mother or the baby. And we're also saying that hypertension in pregnancy is when the blood pressure is greater than 140 over 90, which is being done more than twice. Then, if a single reading of a mother is exactly 160 over 110, we can also diagnose the mother that she has hypertension in pregnancy. So now is either hypertension in pregnancy or gestational hypertension. That is what is known now. Please, let's keep our questions coming. We shouldn't wait. Let's bring the questions and let's answer it along whilst we do our education. Now, there are some risk factors which are involved in somebody suffering from hypertension in pregnancy. So somebody will ask, how would I know that I'm at risk or not? If you have multiple gestation, that is twins or triplets, if you have any kidney disease or you suffered kidney disease before, if your age is below 20 years or above 40 years, if you have an autoimmune disease, and if you have a family history of hypertension, then also if you are black, your race, you are black, or you are Asian, or you are Black American, possibility that you can develop hypertension in pregnancy is high. Now, the causes of hypertension in pregnancy is having a high blood pressure before pregnancy or your past pregnancy, and also having a kidney disease or having diabetes. So you know you are diabetic, at the same time you have kidney disease. Then, like I said earlier, if you are 20 years below or 40 years and above, if you are pregnant with twins or triplets, or if you are an African. Then we have the signs and symptoms. We put a question on our page, and we asked what are some of the signs and symptoms of pregnancy, gestational hypertension, or hypertension in pregnancy. And we're seeing that one is headache. So the headache comes, it doesn't go away. The frontal severe headache, it comes and it goes away. It comes and it goes away. It doesn't um, go away totally. So you could realize that that frontal severe headache that you can't bear, it comes, then it goes away. Then we have edema of the feet, that is swelling of the feet. So there's fluid retention, that you realize that your feet are all swollen, and you immediately the midwife touches or presses, it sinks. It sinks. It doesn't come out. It takes a longer time before it comes up. So edema can be general body edema, which is known as anasaka. From head to toe, the body is so edematous. Or it can be edema of the feet, edema of the face, edema of the hands. So any type of edema or fluid accumulation of any part of your body is also a sign of gestational hypertension. Then sudden weight gain. Immediately you realize you start growing fat or gaining more weight than usual. You get to antenatal, we check your weight. You are 80 kilogram. The following 2 weeks, you get there, you are 85 kilogram. So within 2 weeks, you can't get 5 kilogram. You can never gain 5 kilogram as a pregnant woman. That tells us there's a problem, and at the end of the day, you need to look at that. Then also your vision changes, it becomes blurred. You barely even see things properly, either during the day or at night. Even if the lights are all on, you have that blurred vision, which is also no good. Then we have nausea and vomiting. So persistent, you vomit a lot, you feel nauseated in anything you come close to. Anything you come close to, you feel that nausea. So you become nauseated so easily, and persistent vomiting also is also a factor. Then there is pain at the upper right side of sorry of your belly. So this is my belly. Then you feel that severe pain. Nobody even presses. You don't need anybody to press. You feel that severe pain. Then urinate, you feel like visiting the washroom, you go just a little. So I wanted to demonstrate to my viewers. So this is my right side. So immediately after your belly, between your breast and your belly, you feel that severe pain that even nobody touches, you feel that pain. So these are all the signs and symptoms that shows that you are actually or you are developing hypertension in pregnancy or gestational hypertension. So, like I said before, I always like going back for my viewers because the cardinal point is first when your BP is 140 over 90 and we check it more than 3 times. But immediately we take your first BP and it's 160 over 110 just once, we can diagnose you as hypertension in pregnancy. And like I said earlier, some of the signs and symptoms is nausea, vomiting, severe headache, then pain at the upper part of your right belly. Then you also get blurred vision. At the same time, you feel like urinating, your bladder is so full. You get to the washroom, there's just a little urine that comes. So when a little urine that comes, automatically there'll be fluid retention, isn't it? So edema will also set in. And like I said earlier, from our head to our toe, when it's generalized edema, it's known as anasaka. But when edema of the feet, edema of the hands, edema of the face, all of them is edema, irrespective. So don't let anybody lie to you, it's a boy or you are pregnant with twins. Whilst you've done the scan, it shows that it's only one baby. Whilst you've done the scan, you know it's a girl, it's not a boy. And one thing we should always remember that when you are pregnant with um, twins, it's a cardinal indication that you can suffer from edema. At the same time, it's that you are predisposed or you are at risk of suffering from hypertension in pregnancy. But when you have a single child, there is no way you can have generalized or swelling of feet. When the hypertension sets in, that's when you have the edema of the feet, the face, and the hands. So somebody will say, how can we diagnose you as a pregnant woman that you have hypertension in pregnancy? So we are going to talk about diagnosis. So the first one is having the blood pressure being read twice or once. So the twice is when it's 140 over 90 and the ones is 160 over 10. So we check the first reading. We give you 4 hours to rest. We can put you on plain nifedipine, that is the medication to check if the BP can come down. Then we note it down and make sure that we wait for that 4 hours. Then we can recheck again. So one thing I always tell my mothers is when you go for antenatal, you should know that day you are going to spend quality time with your midwife. It's not that when you go 5, 10 minutes, you are expecting to go home. No. When the midwife or your doctor sees a problem and she wants to detain you, please accept it and just make sure you do what you are being told. And that's why it's always advisable when you are pregnant, you shouldn't go to hospital alone. You should be accompanied by someone. Then also, we also do the urine testing, that is the protein urea. So when you go for antenatal, we let you use the washroom, you pour it into a large container, and we check to see if there's any protein in your urine. Either it's going to be trace, either it's going to be 1+, 2+, or 3+, or more. It depends on what the albustics will indicate. Then also, we check for swelling. So that's why we do the physical examination. So our physical examination is from head to toe. So anytime you enter the midwife's room and she palpates, she checks the baby's heartbeat, she measures the fundal height of your belly. Definitely, she's going to check from your face, your neck, your hands, then your legs, especially because she's going to actually apply a little bit palm pressure on your legs to see that if there is edema, either it has started already, then the necessary precautions will be done. So all these examinations are very, very important. That's what I said. When you go for antenatal, don't think immediately you get there 10, 15 minutes. I'm done with my midwife. I'm in a hurry to go home. That's why when it's antenatal day and you know you are a working mother, any woman is a working mother. Yeah. Just ask permission from your superiors. Let them know today is my antenatal day. Actually, I'm going to spend a lot of time with my midwife, so I would like to take the day off. And that is your right as a woman when you are pregnant. So don't feel shy to talk to your superiors when it's your antenatal day. If they doubt, always keep your antenatal booklet in your bag. As a pregnant woman, that book should always be in your bag. And your next date of visit will definitely be written at the side for you to know when to visit the midwives. Please let's keep our questions coming because we would like to answer your questions. Then also we are checking for weight gain. So from 28 weeks, we'll give you another 4 weeks, then 2 weeks, 2 weeks, 2 weeks, then 1 week, 1 week. So every pregnant woman, per every month, because you are having a baby, in a month, we are expecting you to gain between 2 kilogram to 3 kilogram in a month. Yes. So between 2 to 3 kilogram. It's not supposed to be below 2 kilogram. It's not supposed to be above 3 kilogram. The nutrition officers will tell you that because they will, we have a way of making sure that the mbanda, the baby, is adequately fine. When it's above 3 kilogram, then you are gaining weight abnormally, which is not good. When it's below 2 kilogram, you are telling us that you are not eating properly, so malnutrition. So we are going to give birth to a baby who is small for gestation. If it's above, also, we are going to give birth to a baby which is an obese baby. Yeah. So let's also bear that in mind. Then also, if we continue to do more of our tests, so liver and kidney function test, liver and kidney function test. So we do that also to make sure or to ascertain that we can diagnose you with hypertension in pregnancy or gestational hypertension. Then also we do clotting time. So the clotting time is we take a sample of your blood to see how fast the blood can clot. Now, when you have hypertension in pregnancy, it takes a longer time before the blood can clot because every human blood has a time frame when you take, it should clot. It shouldn't be too slow. At the same time, also, if it's too slow, it's not helping because when you deliver, you can equally bleed to death. And we are looking at all these precautionary measures to make sure to prepare you for labor because we know the condition you are in and we want to be sure that we put in all the precautionary measures so that we can have you alive and have baby alive also. Then we'll get to treatment. The treatment first is we'll refer you to a nutritionist or a dietitian so that a diet plan will be drawn for you as the pregnant woman because we believe in prevention more than cure. So we'll start with the preventive measures, that is you seeing a nutritionist or a dietitian. They will counsel, they will educate, then they will help you to draw a diet plan which you need to follow religiously, so that when the time is up, we know the BP will be down, it can come down a little bit. Your life wouldn't be in danger. Your BP should be controlled. It should be controlled. There are some BPs you can never control, especially those ones who didn't listen to advice, who didn't listen to what the nutrition or the dietitian said, and they were doing their own thing. Because the normal norm is as a pregnant woman, you take your 3 square meals, right? And snacks. The snacks can be in between. The snacks majority should be fruits and vegetables. And you should eat low sodium diet. Low sodium diet. Your food should be more of the greens and less carbohydrate. High fiber diets, less oil, and more of water. And you add your prenatal medications to it. So this is the regimen, the little I know that I can share with you as a midwife. But when you go to the nutritionist or the dietitian, that is their specialty. So they will go into details and explain to you what you need to adhere to. Those ones, once in a while, you can take. Those ones you need to avoid totally. You don't have to even take it at all. They are going to guide you through it so that you can have a safe pregnancy, so that your BP can be controlled and you can have a safe pregnancy, deliver, and be still when you deliver. We are expecting the BP to come down. When we adhere to all this, your BP will definitely come down. Then also, we have to monitor the fetal movement and also the fetal heart. So by 28 weeks, there's a chart that we give to our mothers to monitor the fetal cake count and movement. We will teach you how to monitor the cake count, when to do it. So in a day, we're expecting baby shouldn't kick no less than 8 times within 24 hours. It shouldn't be less. So it's between 8 to 12 times in 24 hours. That's what is expected. So when it's below, that should tell you baby is in distress. When it's too high, that should tell you baby is in distress. So immediately you realize also the whole day your baby has not kicked, maybe from morning up to 2 p.m. You've not heard your baby kicking. 6 p.m. baby has not kicked. Mommy, don't sit home and say, oh, I'm waiting to see if I sleep. There is no way, even when you sleep and your baby kicks, you actually, it's only few mothers, especially when they are weak, that's when they feel. But early hours, you should feel your baby kicking. You should feel your baby moving. So either baby should move and baby should also kick. Those are the things that you should pay critical attention to it so that you can work towards it. So the chart will be given to you. You'll be educated on how to stroke your kick counts and your movement. Then when you realize it's below, you just make sure your kick count is always in your antenatal booklet and you rush to the nearby facility and let them check on the fetal heart and see if baby is there. After that, I know they are going to run a scan for you. Also, if there's no scan services there, they will definitely write it for you and encourage you because there are scan services which work 24 hours now. That the nearby, one nearby you can equally get there and take the scan and make sure baby is fine, baby is taking well, and baby also is doing very, very fine. Then also you will be asked one of the treatment that we can also give is a non-stressed testing. So this test is used to measure the heart rate of the baby. So there are tests that will be done. At the same time also, we compare that one with the scan that you do. So by 28 weeks, you definitely take fetal abnormally to know if baby's heart is all right, baby's eyes are well formed, baby's brain cells are all formed, the spine, the feet, the arms, if they are all formed. So there'll be that comparison between that one and the non-stress test also. Then we do a biophysical profile for the baby and the mother. So the biophysical profile is the one that we test and combines the ultrasound scan with you, the mother, your K counts that you've done, what you've actually experienced as a mother, that the few days between you and the baby, how baby moves, how often does baby move. That will give us a fair idea. We know that, oh, when we're going to take the scan, baby's heart rate was maybe 134 or 136 or even 140 or 150. But at home, you realize that unless you eat something that really excites the baby, and the baby will actually move. Or when you take, some mothers will tell me, when I take chilled water, that's when I feel my baby coiling. Oh, when I have that intimacy moment with the father, that's why I see my baby is overjoyed. So all these records are so important to your midwife and your doctor because they would like to know all this and they would like to actually measure it. Then we have the fetal Doppler, the one that when you go and visit your midwife, she'll put it on your tummy and she will check the heart rate of the baby. Then also, we also have the lab testing that we do, which I said earlier, by checking the protein urea. Then, because of your condition, we know that baby, possibility that baby will be delivered before 37 weeks is high. So you'll be put on some medications. So corticosteroids, which is Dexa, will be given to the mother to prepare the baby's lungs. So that baby, immediately baby is being born before its due date, baby can breathe and breathe properly and baby can survive. Because if these medications are not given, possibility that baby comes out, breathing becomes a challenge for the baby is high. And we don't want to lose our baby because that journey that you've gone through, either 30 weeks, either 32 weeks, 34 weeks, 28 weeks, it's not an easy journey. You modifying your diet, you being on BP medications, you having enough rest and sleep, you changing your lifestyle totally to suit the condition that you have. It's not an easy journey. So we give you that as a booster to the baby so that the lungs will be fully matured enough so that baby can breathe even when the baby is born premature. Then we have possible complications that can happen when you have hypertension in pregnancy. So, when the blood pressure is so high, there's limited blood supply to the uterus, to the liver, to the kidneys, and to the brain. So, when there's limited blood supply to the uterus, automatically baby will get less blood supply and less oxygen. At the same time, also, if there's limited blood supply to the brain cells, automatically it will also affect the baby. So possibility that a child will be delivered with low IQ is very, very high. Possibility that we can deliver a child with abnormality of the brain is very, very high. Possibility that the child can develop liver problem, kidney problem whilst in utero, because all these places there's less blood supply, and possibility that baby can die is high. Possibility that mother can die is high. So those are some of the complications that can happen. Then the worst of it all is hypertension in pregnancy when it's not properly managed. When it's not properly managed, one, we can develop preeclampsia, which we don't want, because preeclampsia, because the BP is not well managed, it can also turn into eclampsia. And eclampsia is not a good thing that I don't want any mother to ever experience, either eclampsia, preeclampsia. At least we should even stop at the hypertension in pregnancy. That should be our last stop. That should be our last stop. So that properly management, we manage, when there's proper management of the BP, they tell you, you check your BP morning and evening, morning and evening. When you go, you check your weight also. So there will be a chart which will be given to the mother. You've seen your nutritionist or your dietitian. At the end of the day, your midwife gives you your next date of visit. You go. Your midwife has given you her number. If there is any change, you should call her. Please do call her, because it's very, very, very important. Then also, with fluid retention as a pregnant woman, immediately you see that your hands are getting swollen or are getting bigger than usual, because you know how your fingers are before you got pregnant. Please don't say it's normal because I'm pregnant. Yes, when you are pregnant, you know there are some body changes in you. You know you gain slight weight, your preference of food changes, the way you even sleep changes, the way you take in fluid changes, everything about you changes totally. But what you put in, what comes out is so small, it's not good. What you put in, if you put in 100%, at least we are expecting 50% to come out. Then you keep the 50. But when you put in 100% and you only get 5% coming out, or 10%, or 15%, or 20%, and you keep 80%, it's not good. We can keep around 50 to 60 or 65% in our body, but not above 65. Anything above 65, there's cause for alarm. So any slight changes that you see in your body, please call your midwife. Call her, let her know. And I'm sure she will tell you to come to the facility, come with your antenatal. She actually also want to observe you. The earlier, the better, because we say prevention is better than cure. And early detection also saves life. So let's keep this in mind. There are some tips I want to share with my viewers, that when you realize that you have experienced any of these things, I did a slide note for myself that I want to share with my viewers. So, the tips that I want to share with my viewers, the first one is, one, know the reason for your visit when it happens. So, for instance, your hands are getting swollen, your feet are getting swollen, your face is getting swollen. You are curious. You want to know what is happening to you. When you go to your midwife, you ask questions. I always tell my mothers, when we check your BP, you don't even ask, why are you checking? We explain all the procedure to you. Say, oh, mother, we want to check your BP to see if your BP is going up or down. You ask, why do you want to know if my BP is going up or down? For the midwife to explain to you, for you to know the reasons, because now it's focused antenatal. It's not like before. So every mother is special. Whatever condition you come with, we need to spend that ample time with you to explain to you, for you to know what is being done on you. Then before your visit, if you have any questions pertaining to your pregnancy, pertaining to your health, please jot it down, because you can easily forget. So that when you go to the hospital or you visit your midwife, you ask her, oh, I have this one or two questions to ask you if you can help me, because I heard or somebody said or I read. Your midwife is there to answer those questions. Then always remember to bring someone along. Always remember to bring someone along, so that at the end of the day, that person can be of help to you. In case we need to detain you, in case we need to keep you in bed and get a medication at the pharmacy, which is outside, in case a blood sample needs to be sent outside the facility, that patient or that person you came with can do those rounds for you. Then also, always remember, when you are being diagnosed, when a diagnosis is being given to you, just write it down and seek more information about it. Seek more information about it. Then also, if medications or treatment is prescribed to you, always know the side effect. It's so important. It's not that when they give you the medication, you are in a hurry to go home. If they even give you paracetamol as a pregnant woman, you should ask for the side effect at the pharmacy. When they are giving you the medication, ask the pharmacist, if I take this medication, do I need to stay away from food, or I should take some particular food, or I shouldn't take? Oh, if I take this medicine, do I need to sleep, or I need to rest? Can I add fruits? All these questions are so important as a mother. When you visit the hospital, you should know, especially when you are diagnosed hypertension in pregnancy also. Then know why tests are done. So if kidney test is done, liver test is done, your urine, we test it. You should know why we are checking all these things. So the midwife is overwhelmed, all right. She will give you the necessary education. You even go to the lab. The lab technician will also give you his education. You go to the pharmacy, they will give you their education. But when you jot down your questions and you ask, it's going to be a top up for you as a pregnant woman, so that your knowledge about it will be broadened. Then you can also share with somebody. Immediately you see one sign, not signs. You only need one. When she's having a conversation with you, a friend is having a conversation with you, and she's telling you, I went to the hospital, they say my BP is 160 over 110, and they kept me there. You can actually educate your colleague. Then also, you should know that your next follow appointment. So when they give you your follow up appointment, please, if the midwife says it, she writes it in your book. Ask where it's written. Then, at the end of the day, you can do your follow up when it's expected. Then also, we have the key points that we want you to know. But um, I have a question here, but let me finish. Let me finish with my key points on gestational hypertension. Then I can answer the questions. So we know gestational hypertension is a form of high blood pressure. is a form of high blood pressure, which is 140 over 90 when it's being checked between 2 or 3 successive occasions. But when it's above 160 over 110, just one reading, we can diagnose you that you have hypertension in pregnancy. And we know when you pick 50 mothers, we are expecting that 5 mothers can be diagnosed with hypertension in pregnancy. Then also, always when you are pregnant and you are diagnosed with hypertension in pregnancy, always give your midwife a call or your doctor in case you see any changes. Then even if you are not being diagnosed with hypertension in pregnancy and you experience any of the signs and symptoms, that is the severe headache, the pain in your right upper part of your belly, the nausea and vomiting, the blurred vision, and the swelling of the V. So any of this, when you experience one, please call your midwife or your doctor and let them know you are experiencing something like this. And always keep in mind the goal is prevention is better than cure. Then somebody will ask, can gestational diabetes be prevented? Definitely it can. Immediately you realize you are pregnant, don't stay home and say, I'm waiting for some time. When you miss your period, it's 4 weeks. So you are 1 month pregnant. You are not one day. It's 4 weeks. 4 weeks is 1 month. So immediately you are pregnant, you know you have to go and see your doctor or your midwife. And when you do that, at the end of the day, when labs is being done, because your first booking BP is so important. Normally, when it's late and you come, it's not that advisable because we can't measure it. But if by 4 weeks, 6 weeks, 8 weeks, you go for antenatal, it gives us a fair idea of your booking BP. Then, based on that, we can monitor you so that when the BP is going up, we can counsel and educate. If we need to refer you, we need to refer you as soon as possible to save your life and save your baby also. We are also saying that early referral saves life. Then also, you should always call your health provider, either your midwife or your doctor. Call her because when you miss your period, possibility you can even abort is high. Some mothers can differentiate between early abortion and implantation bleeding. There's a vast difference between implantation bleeding and early abortion. So, implantation bleeding, you see that the color is darker, so dark, and you can just bleed for a day or two, then you are good to go. But when the pregnancy is aborted, it's dark, then it becomes reddish, dark reddish, then it becomes reddish, then by the time you realize it will be coming with clots, then bright red. But implantation bleeding sometimes is even dark or light pink, not deep pink. And those ones too, you can bleed for just a day or two. But when it's aborted, you can bleed for more than 4 days. So let's keep that in mind. Let's make sure, let's call our midwife immediately we miss our menses. So these are the key things we want to share with our mothers. I like to go and read my questions so that my mothers um, will actually be happy because some people sent me messages before I came on set. So one of the questions is what causes high blood pressure during pregnancy? So the first question is what causes high blood pressure during pregnancy? So we know in early pregnancy, new blood vessels develop or evolve. So when it evolves, they supply oxygen to and nutrients to the placenta. Then in women, preeclampsia or those blood vessels don't seem to develop or work properly. So if it doesn't work properly, so the new blood vessels, which is supposed to actually transfer nutrients, oxygen to the placenta site that the baby needs, and it doesn't work properly, and there's distortion, there's not enough blood supply, circulation doesn't take place the way it's supposed to take place. Everything about you actually starts going up. Just imagine I hold your nose. You start gasping for air because the fear is it will get to a time you can't even breathe again and you can lose your life. That's what happens. So when there's distortion of the new blood vessels which is being produced or which evolves when you are pregnant to the placenta side, because when you're not pregnant, automatically you don't need placenta. So no new blood vessels is being produced. But when you are pregnant, immediately conception starts, placenta is produced. But when there's distortion, that's when the BP starts going up because the baby also have a heart and the heart starts beating. You also have a heart. So coherently, you have to actually beat the other way around. So when you look at the fetal circulation, if mother's own is going on right, baby's own is going on left. That's how it is. They never meet. They don't have to meet. So when this distortion happens, that's when the BP starts going up. So that's when elevation starts going up. And you see that some of it, the BPs, you can actually not control it. They are beyond control. And those are the ones when we realize 16 weeks, 12 weeks, 20 weeks, we can't control the baby. We can't control the BP. We encourage that when all assessment is done and the advice is to abort the baby to save the mother's life because we believe you are the carrier. You can carry it again and again and again and again. So to save your life, rather abort it so that make sure you are better, ready to carry another one. Then there'll be precautionary measures laid down so that you can carry the baby to the set term before DEXA can be given so that baby can breathe when baby is born. So let's keep that in mind because your health is so important to us. Let me go to the next question. So somebody also asked, can stress cause high blood pressure in pregnancy? Yes, stress may lead to high blood pressure during pregnancy. So you are seriously at risk as a pregnant woman when you are stressed out, either at the workplace, either at home. That's why we encourage immediately you know you've missed your period and you are pregnant, you have to be stress free. That's why one of the components to healthy pregnancy is rest and sleep. Rest and sleep. Because we want to avoid high BPs, that's why we are avoiding stress. So, wherever the stress is coming from, we need to stay away from the stress. So, ways of staying away from stress. One is watching exciting movies that makes you happy. School of thought will tell you when you are pregnant, it's not advisable to watch certain movies like horror movies, like war movies, or even watching sports that you are not sure of the team that you are supporting. That will put you in stress, put you in anxiety. We don't encourage that at all. If you know the team you are supporting will put you in stress, it's best to go and sleep. When you wake up, you ask. If they are done, you ask who won and who lost. Then you are good to go. Then also you listen to soft music. music that will soothe in your soul, music that will make you happy, music that will let you feel so happy that you are pregnant. Read books, novels, or your Bible or your Quran. Texts that will actually encourage you, which will make you happy that you are a proud pregnant woman. Then also, we are saying that things that excites, things that makes you happy, let's do it. Because at the end of the day, it makes you, as the mother, stress free for you to stay away from stress. So, these are the things we should bear in mind when we want to stay away from stress. Even if you like writing, you can also write a small book for yourself during your journey in pregnancy. One day at a time, you can actually take it one day at a time, one day at a time, one day at a time. That's it. So, things that we can do that will take us off stress is very, very important. We shouldn't forget that. Then, let me read another question. Somebody also asks, can dehydration cause high blood pressure? Yes, dehydration can cause high blood pressure. So, at the end of the day, we are saying that um, high blood pressure, when there is less water in your system, there can be constriction of the vessels. And when there's constriction of the vessels, you can suffer from high blood pressure because there will be occlusion. So there will be less blood supply to the vessels and the veins. So you could see that instead of them the blood flow to flow so easy, just like a river water flowing down the stream, it wouldn't be like that. There will be constrictions here and there, here and there. So once we are pregnant, let's avoid dehydration. That is, we should take in enough water. Like I always say, you see our big water bottles that they sell in the markets. I don't want to mention any, but during the day as a pregnant woman, you need 8 of those big bottles. Or if you can't afford, you can buy the sachet, and the sachet should be half bag every day. That is what you need as a pregnant woman, because that same water will also, that's what covers the baby in utero. So the fluid or the amniotic fluid around the water, 99.999% is water. Is water. So if you don't take enough water, you can't get enough water to make sure the vessels are open, to make sure the baby have enough around him or her. So we need a lot of water around us. Like I said last month, we have a new baby in the market. I'd like to show my viewers. Yeah. So this is a new baby in the market. So our head to toe body wash. We are the only product in the market which has hypoallergic. So this one, baby will never ever react to it, either with the eyes or the skin. Today, that's what I'm leaving you with. So go to the market, it's so affordable. Go to all mother cares and Malcolm shops. You will see it there. Go grab one for your baby and use it. We are saying that the blue is mild and gentle, and the pink is soft and smooth. But both of them, when you use it, it will never irritate with the baby's skin or baby's eyes or any part of the baby when the baby comes out. On behalf of my production crew, on behalf of Kasum's baby would like to say thank you and joining us. We are hoping to come your way with more exciting program, especially on skincare when you are pregnant as a woman and when you deliver for your baby, how to actually maintain baby skin till baby grows up. That is using Kasum's baby product. Rashes free, smooth, and silky skin. I'd like to say I love you so much for joining me every last Friday of every month. And thank you. Bye.